Hi, my name is Bridget Medina, and I'm going to be discussing the structure of the eye and some diseases of the eye. Right here is a picture of the eye. This is the orbit. It's a bony cavity that contains the eyeball, the muscles, nerves, and blood vessels. Also, the liquid within the eye that helps us produce, which is what our tears are. The outer covering of the eyeball consists of a relatively tough white layer called the sclera, which is right here. Near the front of the eye, in the area projected by the eyeballs, the sclera is covered by a thin, transparent membrane called the conjunctiva, right, which is here. This runs to the edge of the cornea. You see right here. Light enters the eye through the cornea, the clear curved layer in the front of the iris, and the pupil. So right here, light's constantly coming through here. The cornea is a protective covering for the front of the eye and also helps focus light into the retina, which is in the back of the eye, right here. After the light passes through, it travels through the pupil, which is right here, which is the black dot in the center of the eye. The iris controls the amount of light that enters the eye right here. It allows more light into the eye when the environment is dark. It allows less light into the eye when the environment is bright. So that's when you see that dark iris constricting, getting really, really small when it's bright, and it gets really, really big when it's dark. Behind the iris sits the lens. So you'll see right here is the lens. So it changes its shape to focus light into the retina. And then there's those small muscles called the ciliary muscles. The lens becomes thicker to focus on nearby objects and thinner to focus on distant objects. So you see right here, that's where the ciliary muscles are. The retina contains the cells that sense light and the blood vessels that nourish them. The most sensitive part of the retina is a small area called the macula. So you see right here, this is the retina and this is the macula. The macula has millions of tiny packed photoreceptors, which are called cones. And the higher the density of the cones in the macula, that makes the images that are receiving with the eye a lot more sharper, detailed. Just like if you were to have a high resolution digital camera. So the more megapixels, the sharper the image. Just like the sharper, the more cones we have, the sharper our image is going to be. Okay, so the photoreceptor is linked to our nerve fiber, and the nerve fibers are bundled together, and that forms our optic nerve back here. The optic disc, which is the first part of the optic nerve, is at the back of the eye. So now I'm going to talk about the different diseases of the eyes. We've got cataracts, diabetic retinopathy, and glaucoma. Now, cataract is the clouding of the eye lens, and it's actually one of the leading causes of blindness in the world, and leading cause of vision loss in the United States. It can happen at any age because of different causes, and it also can be seen at birth. The treatment for it involves removing the cataract, but sometimes patients aren't able to do that due to cost, insurance not covering it, and such and so forth. It is diagnosed with an eye exam. They use a slit lamp microscope to look for the problems within the lens and other parts of the eye. So the doctor will dilate the eyes before the exam to be able to look in the back of the eye. Some of the symptoms for cataracts includes blurred vision, faded colors, night blindness, and halos around lights. Risk factors for it include smoking, a family history, steroid use, a lot of time in the sun, and too much alcohol. Like I mentioned before, sometimes it's just a normal change within the eye with age that causes it. Surgery can correct it, which is removal of the cataract, as I mentioned, new glasses, or even some contacts. The nurse's responsibility with this patient is to teach before and after surgery, if that is the treatment we're going with. After the surgery, they will review, hand proper hygiene, eye care techniques, signs and symptoms of infection, and will report to the doctor. Diabetic retinopathy is very common with diabetic patients. It can lead to blindness, and is characterized by a progressive damage to the blood vessel of the retina, light sensitive tissue at the back of the eye. Risk for it is reduced with proper diabetic management, so checking your blood sugar, managing your blood pressure. Early diagnosis helps reduce the risk of permanent damage to the eye loss. It also is diagnosed with a dilated eye exam. Treatment is medication, laser treatment, and surgery. And the nurse's responsibility in this one as well is patient education about managing their diabetes, eating a healthy diet, managing their weight, and daily exercise, and of course, no smoking. Glaucoma, the last disease I'm discussing, is high eye pressure that causes damage to the nerve connecting the eye to the brain. Sometimes there's no symptoms, but sometimes people may experience blurred vision, distorted vision, or some vision loss. There is no cure for glaucoma, but treatment includes medication, laser eye surgery, and trabeculoplasty, which is a laser that improves the fluid drainage within the eye and it reduces the pressure. Nursing management includes preventing further visual deterioration, encouraging the patient to adapt to the visual changes that they are experiencing, and preventing complications and injury. Their teaching also would include how to use their eye medication and explain the purpose and how to take their oral medication. If surgery is needed for this disease, the nurse will do the pre-op and the post-op teaching, as well as prepare the patient for surgery. She will explain about the laser treatment and teach the patient about safety precautions.